This is Rudkowski of WeAreChange.org here in the off-skirts of Puerto Vallarta in a surf town, and in this video we are going to be talking about medical tourism, stem cells, self-help, and so many different things. And to start the discussion, we of course have Chantel, who runs an amazing wellness clinic down here in Puerto Vallarta. And Chantel, you definitely have a very interesting story how you got into all of this. We've been talking for so long, and the stories are just so fascinating. Can you just share with us how you got into this kind of realm and this world of self-help and wellness?
Okay, well, I'm a lady going on 70 years old, and I'm a product of the 60s. And in the 60s we had a lot of fun. And that being said, I had exposure to a lot of older friends, and everybody in those days were doing lots of drugs, so of course everybody joined in. And when I started down that path myself, I was 14 years old. And I was with a boyfriend that was older who was a heroin addict at that time, and he talked me into experimenting for the first time. And that set me down a path that lasted 20 years. So that being said, I mean, I was exposed to a lot of things. I lived in the Haight-Ashbury for a period of time. I lived in Northern California. I lived in and out of Mexico. I did a lot of things. But at the end of that time, I decided that I needed to give back and I wanted to change my life. And I did it all at once. I just decided one day that was the end of my salad years, we'll call them. But I wouldn't change anything at all, because I wouldn't be here doing what I'm doing today, which is 30 years onward of doing wellness. Diet, exercise, stem cells, ozone therapy, chelation therapy, vitamin therapy, extreme nutrition changes, teaching people how to live a better lifestyle, starting with myself. I had a terminal hepatitis situation. I don't have it anymore. I attribute that to these wonderful doctors that I met 20 years ago in Puerto Vallarta that got rid of this liver condition, which never came back. So I hooked up with these guys in Puerto Vallarta, and I've been doing it ever since. So that being said, I've been in association with many alternative doctors here in the Puerto Vallarta and Guadalajara area, offering myself as a guinea pig to see if this stuff really worked, because I was really skeptical, especially about the ozone in the beginning. But I saw cancer patients being treated by these different alternatives, and I've been studying nutrition since I was in high school. Even though I was doing the bad thing, it was really fun, but it affected my body in such a way that it was in a downward cycle when I got to my 40s. And so after all the years of the party life, I didn't want to die, and I wanted to do something to prolong my life. And the alternative medicine that's out in the world, that's available in plentiful abundance here in Mexico, saved my life. I do believe that.
It really just starts with yourself and your own health as well, because if you're not a healthy, happy, productive human being, how can you give something back, and how can you tell anyone else how to even do anything, which you shouldn't in the first place. But with myself personally, I ran my body to the ground all throughout my 20s, not just with partying, but also working nonstop, covering crazy protests, covering crazy riots, to where I'm dealing with a lot of medical situations, herniated discs in my back, pinched nerves, torn ligaments, and that's only the stuff I know about. Sometimes it's even hard to walk down the street, sleepless nights, working all night, staying up all night. Just has torn my body up, and really you need to take care of yourself, because if you don't, everything else just starts falling around all around you, in all aspects of your life, and that's why, you know, we're down here trying different stuff, and I'll definitely let you know what's going to happen to me and what's going on. But can you tell us about some of the people that came down here and some of the therapies that you provided to them and some of the stuff that you saw directly help people? Because also this does need to be said. Every human body is totally different. What may work for one person may not work for another person. So it's good to understand your body and also take things very slowly. I always come from a very skeptical mind as well.
Well, as you know from the video that you made yesterday, that Jeff Berwick just left here. But we've had a lot of very interesting people over the years. We've seen people that are in the entertainment business. We've seen people that are in Fortune 500 companies. We've seen people that can barely scrape 2 nickels together, but we treat them anyway because we're seeing people that have dependency problems. So we're using some controversial tools to treat these dependencies. And that being said, Ibogaine is what is being used to treat dependencies. Over the years, which would be the last 15 years, we've seen more than 3,000 people. So we do a combination of different things, many different alternatives like ozone therapy, which is the crown jewel of everything because it works for everything. You can't fix one thing in the body without fixing the whole body, which includes nutrition, oxygenating your body, which is super important because that gets the toxins out. And it also helps in rejuvenating tissues, and like the problem that you said with your back, the herniated discs. We're doing things down here that they do in America, they just cost extremely less money. A herniated disc like yours, for example, can be fixed with stem cells and ozone and plasma-rich platelets, and they're injected into the herniated discs. We do that kind of work down here. There's many doctors in Puerto Vallarta that are capable of doing it. They have degrees in alternative medicine. I associated myself with 5 doctors here. So I send the people that come to us. I do the housing, and I do the translation, and I do all the appointment setting, and everything that needs to be told to people as far as nutrition, because that's the only thing that you can really control is what you put in your mouth. So if you're dedicated to taking care of yourself, you start there. You need lots of water and really good food, but the oxygenation helps a lot. So we fix different conditions. And some of these conditions get really quickly eliminated. Heroin addiction, for example. That being said, if you look at a lot of these videos on the internet and YouTube, you will see testimonials from heroin addicts that have been cured overnight. And I use the word cure very loosely. Nobody's promising or guaranteeing anything, but the medicine changes the receptor sites in the brain. It's scientific studies. There are many doctors in New York City that you can reference, Kenneth Alper being one, that will tell you about the effectivity of Ibogaine on the brain and its ability to close the receptor sites so it doesn't need opiates anymore. That being said, you can use that in conjunction with other things in light dosages for things like depression. And I don't tell people to use these things that I don't use myself. I've used all of them on myself because I've been on my own health quest since I was 36, since I got clean and sober, and have been that way ever since.
Yeah, there's definitely an influx of medical tourism down to Mexico. I would say in large part because of the corruption that happens in the U.S. medical system, the insurance system, that prices of medicines are going up dramatically, and it's very difficult for a lot of people to afford them. And also at the same time, there's also this kind of culture in the medical industry to just throw pills at you. I mean, I've been dealing with certain things, a lot of different allergic reactions, had my body break out in hives one day. The doctor looks at me like, we don't know what's wrong. Here, go take some antibiotics and steroids. I had a bacterial infection, sty, and then impetigo all come up randomly, and they're like, yeah, you're probably dying of a crazy disease since you just came back from Africa. And you know, they're freaking me out. They're giving me, a lot of times in recent experiences, this is not always the case, but this is what I just experienced recently. There are some good doctors out there and holistic doctors who do want to do the right thing, but you can't underestimate the culture of, here's an antibiotic, here's Cipro, here's a steroid, which they gave me for styes, which is the wrong treatment. You're not supposed to give that for styes, when a simple tea bag, and I just put it on there, relieved and solved all of my pain. There is a lot of corruption, there is a lot of money, there is a lot of pharmaceutical dealers who are just out there to make a buck no matter what the problem is. And it's creating also a bigger problem since so many people are on antibiotics, and I've been, you know, doctors have been suggesting antibiotics non-stop to me, whether it's a tooth infection, whether it's a sty, whatever. There's so much that antibiotics are becoming irrelevant, and there's like superbugs even being created just because of that. Can you talk about the U.S. kind of medical system and what you can't do in America, but what can you do here in Mexico?
Sure. I go to the United States to visit fairly often. I don't go to a doctor up there because they have a tendency just to send you as a referral. If you go to an ER, for example, I went to the US recently and I had a slight medical problem. It was, here we're not going to do anything, take all these antibiotics which cause problems in your intestine, and then you got to fix that. So down here the doctors have a tendency to listen to the patient. They take more time, the intakes last an hour to an hour and a half. That doesn't happen anymore, unfortunately, in the United States. I spent a long time up there as a young person. I lived in the San Francisco area, and the medical system in the 60s at least was different. Down here we have things available that you can't get. The doctors down here can still use things for very serious diseases that are not permitted in the United States. Things that are used still in Europe, here and in South America are not permitted by the AMA or the FDA in the United States. Just as an example, in the United States in the 60s, they used Laetrile for cancer. The FDA stepped in one day and said, we're not using that anymore because it works and it's not going to be part of our protocol. But it's still used in the alternative communities in Mexico, that is for sure. The kidney dialysis, for example, it's extremely expensive in the United States. That's why many Americans come to Mexico. Many places in Mexico, they go to Tijuana, they come to Puerto Vallarta, they go to Acapulco, Guadalajara, because the kidney dialysis centers are a fraction of what they are in the United States. And the doctors all speak English. It's the same care, it's the same machinery, and the care that goes along with it, the doctors will tell you to have this particular diet. I've noticed in the United States when patients come down and talk to the doctors, and I sit right next to them to do translating in case the doctor doesn't speak English, the American doctors never suggest a change in diet. Down here, completely different story, because it's really important. So we are not hamstrung down here by, we have COFEPRIS, and COFEPRIS is like your FDA. However, it doesn't hamstring the doctors. We have an association that's like the AMA, but the doctors are not penalized, and the litigiousness that you are much exposed to in the United States doesn't exist down here. There's not a lot of demandas or lawsuits for malpractice, because it's just not done down here. Things are done a little bit more carefully. So in spite of Mexico being not up to American type standards, the care down here has always been very concise, We don't use frog skins for medicine. It's done in a manner like you would receive in Spain or Portugal or France or Italy. Same kind of care.
Yeah, I mean, it's definitely a very interesting topic that people, should discuss and should see all the different options. Personally, my insurance cut off, and they're like, yeah, we want all this extra money. I'm like, there's no way you can afford that. Mexico definitely has been treating me a lot differently. I mean, I'm changing my diet when I'm here. I'm going to the beach every morning, swimming. But most importantly, the doctors do put into consideration a lot more than just saying, hey, have this antibiotic, have this antibiotic. And they try to figure out all this other stuff that's really happening within your body to find a cure, and not just something that will keep you away for a couple months, but have you coming back as the industry kind of does. But I think the major topic, and this is kind of the topic that a lot of people are still finding out about since it's so brand new, and that of course is stem cells. We do see a lot of stem cell work in the United States totally banned, but we do see it up and coming here in Mexico. There's also a lot of controversy surrounding it. There's also a lot of people saying, this stuff is still not tested, no one knows what's really going on. What has your experience been with stem cells? How would you even describe stem cells, and what should people know about them, since there's such big controversy and people can't get them in the United States?
Well, as you saw yesterday with Jeff Berwick, the stem cells that are provided are stem cells that are produced in different manners. They either come from bone marrow, they come from belly fat, they will come from umbilical cord, and they will come from placenta. Those are the four major types that are offered here in Mexico. Most of them come out of hospital laboratories. They're cultured. They have the same strict conditions that you have in the United States. These doctors all speak English. There's no controversy here about embryonic stem cells because they are never used down here. So we're not having controversy about that religious and moral question, because they're not coming from those places. What we see down here is wellness all the way around. In the last 5 years, the doctors that I've been associated, 7 years, the doctors that we've been associating with and the thousands of people that they see, I haven't seen anybody personally myself having any secondary side effect with the stem cell. No growth, nothing out of the ordinary. They do not put stem cells. The doctors are very careful to do a workup. They won't put stem cells in anybody that's had cancer actively for the last 2 to 5 years. Really careful about that. But they're using stem cells in ways here because they're easy to produce, let's say, and they're economic to produce. The hospital laboratories can do them very quickly. There are many companies here that are producing different kinds of stem cells. They're all backed by our COFEPRIS, and then it'll say right on the vials, COFEPRIS approved, which is FDA approved, just like you would have in America. So there's not a question of sepsis, there's not a question of sanitizing, nothing like that. Everything is done in a very sterile manner, as you saw yesterday with Jeff's stem cells. Doctors present, 2 nurses are present, everybody's gloved, everybody's got masks, everything's delivered directly from the laboratory. So Jeff is feeling wonderful today after 1 day just having his stem cell implants, plus his transference factors. So there's a lot of things that can be offered here that are out of the realm of economic possibility for most Americans, which is unfortunate. That's why the tourism industry has another category now. It's medical tourism, and people are flocking to Mexico. There's a place on the other side of Yuma called Molar City, and Americans flock to Arizona to walk across the border to get a crown for $200 instead of $2,000. So this is happening a lot here, and people are coming mostly from America because the Canadian insurance is pretty good. The Europeans have great coverage. We don't see many of those, but the Europeans that live here in our town, they go to all the Mexican doctors here. They're all, and this is kind of hippie-landia, this town. So they do a lot of alternative stuff. Nothing's out of the realm of possibility here. Especially the herbal medicines. Instead of taking a Valium, for example, they'll take a plant out of a tree, which is a passion flower plant. They'll boil it up, they'll make it into a tea, and they'll drink it instead of taking a sleeping pill, Ambien or Valium. So those are the kind of things that we see down here, because the herbal medicine was huge. When all these years, you used to see herbolarias, and they were on every corner. So if you were sick, you went into the herbal shop. The doctor, like in Chinese medicine, would package you up passiflora, boldo, many kinds of different, the manzanilla to sleep. So they were doing that for a long time, and then it became more westernized. But the doctors aren't throwing prescription meds at you. They don't see you and say, oh, here, take an antibiotic. They talk to you and try and figure out what's the root of the problem before they even prescribe. And this is the other thing that's really important. The doctors down here do not have runaway prescription pads writing prescriptions for opiates. Okay, we don't have an opiate revolution down here. We don't have an opiate epidemic down here, because those things are not readily available. The pharmaceutical companies down here don't make them. A prescription for an opiate is almost impossible to come by prescription-wise.
Yeah, and we have seen the pain and suffering that the opioid crisis has been creating in the United States, that has been created by government, the pharmaceutical industry, and also the medical industry, which people should be skeptical of. Again, everybody's different. Thank you so much for this information download. Thank you so much for bringing me in, helping me out. We're going to be doing some remedies that you guys could follow through. I'll be posting them on Facebook or Instagram or whatever. But anything else you would like to say about just what you're doing here and what people should know about medical tourism, stem cells, and just you?
Well, what we really love to do is go to Anarchapulco. This will be our 4th year there, and we talk to thousands of people at Anarchapulco, and we want to be able to spread the message that there are alternatives for your health. If you've got a dependency program, you can come down here and do that. If you've got other kinds of health issues, you can come down here and do that, and we're ready to answer your questions. There's a plethora of knowledge down here, and it's warm, it's inviting, it's not dangerous, we don't live at the border, and the whole culture is open and ready to help foreigners that come down looking for information and looking for a different lifestyle.
Yep.
So thank you very much, Louis.
No problem. Anarchapulco is going to be insane next year. Not only Chantel is going to be there, a lot of other people are going to be there in the similar field. David Icke is going to be there. Ron Paul is going to be there. It's going to be a huge event. So I hope you guys found this video helpful. If you did, share it with your friends and family members. Stay tuned. And yeah, we're going to have a lot more crazy stuff happening on this YouTube channel. So thank you again so much for watching.